Hi. So I was making a couple of videos for some things that I'm working on, some little projects I'm working on coming up. And I wanted to make this quick little video. I was asked this question recently about what is the right specialty or the best specialty, and what is the best time, when is the best time to have a baby if you're a woman in medicine. And I wanted to make a quick video just to share my experience, because I think it's a really important question to ask, especially being in medicine and being a female. Um, so a little bit about myself and my experience. So I picked anesthesiology, and I'll be honest, I picked it for lifestyle reasons. And I had my son my second year of residency, and that was because in my residency program, the second year was our consult year, and so that was the best time to have a baby. So going back to picking the field of medicine, I think there are a lot of things I would have probably done differently, and certainly picking a specialty based on what your lifestyle will be like later on. I probably would not advise that, or I would tell myself that's probably not the way to go. I think it's important to find something that you are passionate about doing and enjoy doing, because it has to be sustainable. I mean, you want to be able to practice for at least 20, 30 years, hopefully. And if you pick a field that you are doing solely for lifestyle reasons, it may not be something that you're going to enjoy doing. And so, yeah, I mean, I think that you really have to think very carefully about that. Um, as far as the right time to have a baby and having a baby during training, I mean, to be honest, I had a lot of pressure at that time. I wanted to have a baby at that time because that was the right time. And you just can't plan for those things. You just have to do what's right for you and for your family. And if having a baby is the right time, regardless of when it is in your training, you'll just find a way to make it work. And if you end up having to finish your residency a month later because of whatever reasons, because you haven't, been able to meet all the requirements, then that's just what it is. And I've learned over the years that you just can't plan for things. Things will come up, things will happen, and you only have one life. And so if you can remember that, then I think that it will all be okay. And I think that there is so much positive women empowerment movements out there. There are so many, there's so much support out there that I didn't have when I was in my training over 10 years ago. And I think that there's a huge community of female physicians who are out there to uplift each other and to support each other. And so don't get bogged down as far as the specialty or the timing of when to start a family. It will all work itself out, and find what you love, because I think if I could tell myself something, it would be to really think hard about what is in my heart at that time, rather than the money and the lifestyle and forcing things to happen, because you can't force anything. And so that would be my main advice to you.